Thank you, Achyuta. And on behalf of the Center for Commercial Determinants of Health at IIPH Bengaluru, I invite you all to this fourth episode of Conversations on Commercial Determinants of Health. So I'm very glad I had this privilege of curating these conversations and in that way engaging with a number of scholars and practitioners who are working in this area of commercial determinants of health. Today, too, we have been joined by three wonderful, exceptional scholars whom I admire greatly, and we have a chance to engage with them. Some of you who might be joining us first time, or those who are not very familiar with these concepts of commercial determinants of health, maybe I'll just briefly capture it by saying that in public health, we have been waking up to the fact that businesses have tremendous impact on shaping people's health and health inequities. And while this is not very new, what we have seen is that in last decade and a half, there have been a lot of new scholarship theorizing how commercial entities shape people's health. And I think that's where, whether it's about products which we consume and that's why affects our health, whether it is about a range of commercial practices which are carried out by businesses, or whether they are more structural factors which decides how businesses behave. In various ways, commercial sector is shaping people's health. They are more popularly called commercial determinants of health. And these webinars, these conversations have been a way to engage with different elements or different aspects of commercial determinants of health. And today, we will deal with one such aspect, which is demerit goods and public health. So how I'll go about is that today's format is that I will engage with our panelist speakers more in a conversation format. We'll probably have a couple of round of discussions. We'll hear from them. And then we'll have some time where we will open it out to audience, where we can take up the questions posed by them in the chat box. And we'll try to sort of get those answers or new perspectives around those concerns from our speakers. Feel free to keep typing your questions and not wait till the end of the webinar, because I'm sure panelists can also get then time to engage with you on the chat box. So great. So let's get started. Let me maybe start by first bringing in Professor Sarit Kumar Rout. Thank you, Sarit, for joining. Maybe I'll just have a brief intro of Sarit for all of you. So Sarit serves as a professor of health economics at the Indian Institute of Public Health, Bhubaneswar, in a beautiful state of Odisha in India. Sarit had earned his PhD in health economics and has been working for several years in research and education, and has made important contributions, especially in areas of health financing, economic evaluations, health technology assessment, but also tobacco economics. And that's the area, that's the work through which I came to know about Sarit many years ago now. He has held many prestigious grants and fellowships, including the Health and Population Innovation Fellow, or being a Global Tobacco Control Leadership Fellow at the Johns Hopkins University. I must not also forget to mention that he has made very crucial contributions in the processes of national health accounts. I think those of us who engage with health economics in India would appreciate the value of that process. And many other seminal works related to tobacco and tobacco taxation, which is an area where very few people have worked in India. So thank you, Sarit. I have learned from you about economic evaluations for sure. And I think there have been chances where we both have been together in some of the tobacco control related events and workshops in India. So let me get started with you. I think who is better than economist to engage on the issue of demerit goods? So maybe if you can start by giving us a bit of a primer on what are demerit goods? How do we understand demerit goods and services? Why we in public health should be concerned or should be worried about demerit goods? Yeah, over to you.
Yeah. Uh, Thank you very much, Upendra, for a very nice introduction. And also, thank you very much for inviting me for this webinar. So, good afternoon, all the speakers, fellow participants. So, the basic question which Upendra has raised on demerit goods, let us understand what is demerit goods and why these demerit goods are quite important for the people who are working in public health. So demerit goods basically are those products whose consumption, if left unregulated, that will create a lot of harm to the society. Simply, so if some of the products are those that if we leave these products unregulated, if you don't control the consumption of those such products, then that will lead to a lot of harm to the society. Therefore, these products are socially undesirable. Society doesn't want such products. And the beautiful examples of demerit goods are tobacco, alcohol, and other harmful products, which are, from a market economy point of view, these are essential from the market point of view because it generates revenue. But from a social public health point of view, these are harmful products. Therefore, those consumption should be regulated. And in contrast to the demerit goods, merit goods are those, there is a concept in economics is called merit goods. Merit goods are those which are beneficial largely to the people. There are health, education, these are called merit goods. And if these products are left to the market, many people cannot purchase those products because it debars them from the affordability point of view. So these are two contrast things. So one product, if we left to the market, people will highly consume it and it is harmful. And the merit goods, if we left to the market, then many people cannot purchase because these are beneficial for the societal point of view. If you don't provide health, if you don't provide education, then many people poor purchasing, they don't have purchasing power, they cannot purchase these goods. So they cannot have health and education. Therefore, government should provide merit goods and government should regulate the merit goods. This is a very fundamental difference between merit and demerit goods. And if you look into the characteristics of demerit goods, the characteristics are that the one of the it creates a lot of negative externality. So what is negative externality is? So basically, the externality is something which affects anybody who are not directly party to that. Either it is a consumption or production process. So it's called spillover effect. It's a third party benefit or third party cost. For example, second-hand smoking. I am not a smoker. Somebody else is smoking, but I am affected by that. Environment pollution. I am not directly party to the environment or industry, but the industry creating a lot of environmental pollution, I am affected by that. So these are negative externalities. So demerit goods generates a lot of negative externality. Second characteristic of demerit goods is that it is the products, the consumers don't have adequate information about the merits or demerits of that product when they consume it. Therefore, the consumers, they don't know if I am consuming something, I don't have a complete information about that product. Therefore, I am consuming it. So therefore, information asymmetry or lack of information is another characteristic of demerit goods. And the third characteristic of demerit good is that it is overproduced. And if it is left to the market will always basically there be tempted to produce such type of products more. So these are some of the basically basic features of merit and demerit good. I'll stop here.
Thank you, Sarit, for this basic sort of understanding for us. Um, so, indeed, put simply, these are socially undesirable goods, like you say, and there is a room for state intervention because there is some sort of market failure when it comes to demerit goods. What I'm tempted to ask you is that, you gave the classic examples of, let's say, tobacco and alcohol. Now, more recently in public health debates, we hear about more number of goods and services. We often hear about ultra processed foods, which are considered to be risky for public health, and whether we should call them demerit goods. I think more recently we have seen that in a tax reform, the current government has put sugary beverages under the same tax category, right? You mentioned about environmental pollution, and I think in most of the Indian cities we have that problem. I think globally it is becoming a problem, and vehicular emission, fossil fuel use is one of the major contributor. Can we call all of them demerit goods? I think lately social media has come under the scrutiny, particularly for young people. We have seen Australia legislating, and I think India already some debate has started whether we should restrict minors getting into social media. So it looks like it can become also a slippery slope, where do we stop? What can be called demerit goods and what not? And it's a classic tension between, more moralistic, paternalistic sort of ideals versus more libertarian values. So how do you see this? How do we navigate this dilemma?
Yeah, that's a very fundamental, it's a very good analogy which you explained of how many products are now basically considered from public health point of view, from societal point of view, that is undesirable. And shall we put them in the bracket of demerit goods? That's a question. Even if traditionally it has not been defined as the demerit goods, traditionally these products like the SSB, like sugary sweetened beverages, and even social media for the youths, even if they have a lot of undesirable social impact, can we classify them as demerit product? And that's a question. Even if it is not officially anywhere defined or something like that, but if it is, its consumption has a lot of social harms and it creates a lot of negative externalities. And if we apply this definition to these products, and if we largely it is false, largely and loosely it falls into those domain of demerit goods, and we can loosely call it as demerit products. That as a from a public health perspective, from a health ground, we can define these as demerit goods.
Right. I think you also highlight how then we in public health need to create a much more evidence base if we have to keep justifying more such products as demerit goods so that it doesn't become only a moral sort of imperative. Great. I think I have many more things for you, but maybe I'll come back to you again in another round because I think somehow public health cannot move away from economists, it looks like. But let me move to our another speaker. I'll bring Anna in this debate. Thank you, Anna, for joining from UK. So just a brief introduction for those who have joined today. Professor Anna Gilmore is a professor of public health at the University of Bath. Anna is a public health physician who went on to get MSc and PhD in public health. In fact, Anna is a global leader, really a leading global voice in area of commercial determinants of health. She has developed quite a few models and taxonomy on of how commercial actors shape people's health and health inequities, something which is at the core of CDOH. But tobacco control is another area I think Anna has been contributing for several years now, has received several recognitions, awards. And I think many of you might be aware about Tobacco Tactics, something that was developed under Anna's leadership, a really groundbreaking knowledge platform which exposes tobacco industry interference tactics, and I think has been widely used by civil society organizations, advocates, researchers, media, even policymakers. So I think wonderful to have you, Anna, here. And she has been a generous mentor. She has been guiding me in my current senior fellowship. Maybe to start with, Anna, I think we heard about an economist talking about demerit good in a classic terms. Um, I'm a bit curious to hear from you how you, as a more of a CDOH researcher, engaged with it for a while, how to situate demerit goods within the commercial determinants of health discourse. Some of us have been trying to actually understand better how these commercial determinants of health kind of discourse became dominant and how it is being legitimized. And what we notice is that, in fact, many researchers who worked in the area of demerit goods, I think you yourself has done amazing work in the area of tobacco and tobacco control, have made important contributions in conceptualizing commercial determinants. And I think much of the earlier scholarship, when I hear, it's much more about framing CDOH as commercial entities and commercial forces which are detrimental to people's health. In fact, what comes to mind is this Lancet comment by Ilona Kickbush and others, And I understand that over time things have changed. In fact, more recently, the way WHO defines it, and I think the Lancet series where you led a paper on conceptualizing CDOH, we are broadening up. We are broadening up to many more kind of commercial players and not just so-called harm industry. So I'm just curious to hear, how do you see this? There has been a bit of a legacy of demerit goods work on CDOH. How to really understand it?
Yeah, I think you can think, oh, thank you so much for that, for inviting me, and for that lovely introduction, Upendra. And I'm very excited about the work you're doing, I want to say that. So I think you can, the simplest way, you could think of commercial determinants of health as in two areas. There's the sort of demerit goods, or what we often call more simply health harming industries. And that's really how it started. So before we had the term CDOH, we had terms like industry vectors and corporate disease vectors, really recognizing that huge amounts of harm come from these industries. And the interest really started with the tobacco industry. And the fact that in tobacco, we made progress because there was a research focus and an advocacy focus and a policy focus on the industry. And yet we could look at other areas like alcohol and food and gambling, and that focus wasn't there. And yet it was tobacco was the one area that was making progress. I mean, really globally, it's the one area where we have, reduced tobacco sales, and many countries reduced tobacco prevalence. And so there was this sort of realization that we really need to focus on industry and understand industry, address conflicts of interest, and that is a key way forward. But then really what happened, and if I explain my personal story, maybe it makes it easier to understand. So I'd worked in tobacco control for years, and the last major policy really that we got in this country was plain packaging of cigarettes. And already at that point in the UK, we had some of the strongest tobacco control policies. I had a research group here, working on the tobacco industry, one of the biggest research groups, globally, really working on that. We had brilliant NGOs, we had committed civil servants, and it took 9 years from start to finish to get that policy in, because the industry fight against it was so massive. So every day there would be a new front group, but it was overwhelming, and we tracked that really, really carefully. And really, if we hadn't been in that space researching what the industry was doing, that policy would not have got in. We were not the only players. There were plenty of others. It was definitely not us alone, but it was a key element. And then our evidence was also used in the legal challenge that the industry brought against the government. It was used in the government's defence. And after that, I just thought to myself, this is ridiculous. If we've got a country where the industry is denormalized, where we have that amount of capacity to, counter the industry, and it takes 9 years, that's unethical, it's immoral, it's we don't have the capacity to do that in other places or on other products. So we have to see this as a system problem. We were fighting in a system that was set up against us. And so for me, that's the other element of commercial determinants, is to understand the soup that is swimming in, the system that's up against us. And so and I personally think that's really essential. Within there is some tension. So there are some, I think, people in public health to focus on health harming industries and non-communicable diseases is a sort of comfort zone for public health. To get to that bigger picture, we have to start looking at political and economic systems, externalities, what do we do about it, corporate power, a whole load of other wider issues. So it is more messy, but it also brings us into, we need to get into contact, the problems with climate change, the problems with inequalities. These are all really interlinked. And personally, I think we have to go there. But I think in reality, the way a lot of people work in public health is, there are people working on tobacco, there are people working on alcohol, there are people working on food. And for this sort of immediate gains, people probably have to stay, some of them have to stay in those silos. But I think the rest of us really need to link up and link way beyond public health and start pushing this wider agenda, because it's not sustainable otherwise.
Great. And thank you for actually using your own personal journey. I think it makes it easier to understand this transition. And I think many of us are facing the same kind of path and dilemma to on one hand, kind like you said, on one hand, it's a comfort zone, to work against tobacco and alcohol. On the other hand, I think what I liked and take from you is that in a way, this course of commercial determinants of health has helped us to move towards systems, yeah, the more deterministic kind of forces beyond just individual sector or individual industry. And I think that's critical, and it's challenging. I think it will put us in zone of a bit of a discomfort. We'll have to probably open out and get familiar with a lot many other issues. I think in some sense you are answering what I wanted to ask you, which is that in tobacco we have done so much. Yeah, I mean, of course, I still have feeling that in India we need to do a lot more. But there is a sense that, yeah, I mean, there is a global treaty and there is a relative denormalization of tobacco industry. It's not seen as big stakeholder now in tobacco control. There is a lot of regulation, including, in India, there is a prohibition on certain forms of tobacco. But we don't see a similar momentum on alcohol, at least in my country. Yeah. And when it comes to ultra processed food, we have a long way to go. We don't even have front of pack labels. There is really long way to go. And it looks like that the folks are a bit, they are into groups in public health. We don't see much connecting of dots happening. And I think I see this as a challenge on how to break from this kind of silos, how to work together. Is it just a challenge of not knowing enough things, or is it just a challenge of being in comfort zone? I just wanted to understand how this happened in UK, or how this can be done in different places where we move away from silos and start contributing to understanding and exposing the larger systems which are driving some of these challenges.
I don't think we've got all the answers, so we haven't, I don't think anyone's got all the answers. I think some of it is about, at individual level, those people working in those areas, linking with each other, but they also have to keep discussing to sort of, find a shared vision. I think and that's within public health. But if you think about it, there are people working on NCDs in general, so that then covers all of the health harming industries, I would say. But to my mind, it seems silly not to be doing that, because I mean, our work shows, you mentioned some of the taxonomies and models. We started with the tobacco industry and we showed how it influenced policy. It's what we call its corporate political activity, and we've now gone on to show that actually food, alcohol, gambling, etc., use exactly the same commercial practices. We're now looking at the fossil fuel industry. The findings are the same. If we look at corporate influence on science, we've developed the science for profit model. And again, it shows that even a wider set of industries are engaging in exactly the same practices. It makes no sense not to tackle them together. And the policies that we want, for those health harming industries, the most health harming, we're trying to address really the 4 A's: affordability, availability, accessibility, and attractiveness. It's far simpler to go to governments and say, here are our messages, that it's consistent. And if we're all consistent in our messaging, I think it makes it far clearer. I think as we move to that broader CDOH agenda, it is more messy. I mean, I started sort of mapping it out for myself to kind of think about, who do we need then? If you think, we need academia, we need civil society, we need government departments. And so far we've talked about, tobacco, alcohol, food, and NCD prevention. That's sort of down here. I believe we need to get the clinicians on board. So a huge issue here, and I'm sure our health systems are overwhelmed because there is so much poor health that is entirely preventable. I mean, one of the things that really worries me is that increasing rate of cancer in the under 50s. I mean, it's going up everywhere. We then need to add into that small area, fossil fuels and the environment. The health impacts, you touched on this, of fossil fuels, I think have been really underestimated, but that needs to be firmly in the sort of health arena. But then we need to, look at the wider issues. human rights, children's rights, labour and employment, poverty and equity, transparency and democracy, tax justice, alternative economies, the climate, all of that needs to be part of it. So we therefore need to link to academics in those areas, NGOs in those areas, and then that covers pretty much every government department. And we need to do this from local to global level. So it's actually a massive agenda. And I absolutely get that that can be really daunting, but I think we can start with getting our own house in order. And that's what we've been trying to do here, is kind of get the people working immediately in health together to, you know, sign up to a sort of a simple but shared vision, and then to start reaching out to these other allies. And what's quite interesting is I think if you start to do that, health is really quite, you know, conservative with a small c. And there are others in other areas, environment or alternative economics or human rights, that are actually far more radical. So I think we're really cautious, and we can learn quite a lot from reaching out to these other people. And I think we also then need to map out, you know, how do we do this? What do we need on our education agenda, not just in public health training, but actually in schools? Because certainly here, there big corporations are developing educational materials. So alcohol industry on alcohol, and that is being used in schools. Gambling industry on gambling, and that is being used in schools. You know, so we need to start thinking, where do we need to be to start changing hearts and minds and approaches? And I think things like, you know, when we're doing research, if we're trying to evaluate an intervention, we shouldn't just evaluate the health impacts, say, of a public health policy change. We need to evaluate the economic impacts. Look at the impacts on labour productivity, for example, of a clean air zone. And once you start to do that, you can really show these links between health and economies, and start to get the sort of the wider ministries on board that you need to be on board. So if we step back and look at what we need to do, I think we can start to piece it out, and it makes it more feasible.
Great. Good food for thought. I think we need to do more of that thinking through, like you are saying. We need to put our own house in order. We need to do a lot of boundary spanning within public health and then outside. Actually, I sometimes forget that you are a public health physician. I actually wonder what kind of curricula we need for public health courses, which are still very much still health-based, you know, and epidemiology-based. And I think unless we bring all of these into teaching public health, it would be challenging. I can see that. I think you are leading a project called 21st Century Public Health. I'm very curious. I think we'll have to, I think that public health looks very different in how we do public health today. But maybe I'll come back to you, Anna, for more. And maybe for now, I'll move to our third speaker, Jhumki Dutta. Jhumki works with partners in change at New Delhi. Jhumki has a double master's, a degree in political science from Jamia Millia Islamia University, but also a degree in development studies from the University of Sussex. And for nearly over a decade, Jhumki has been into research and practice, and has made important contributions in areas of corporate accountability, business and human rights, generally business sustainability, but sustainability in general, various issues concerning MSME sector, the micro, small and medium sector enterprise sector in India. I think Jhumki particularly sees exceptional when it comes to fostering multi-stakeholder dialogues. That's how I got into knowing her. She's really good at bringing together different kinds of stakeholders, particularly businesses, civil society, and governments, and enabling partnerships to go towards sustainable future, but particularly keeping social justice at the center. I think I have learned quite a good deal about business and human rights from Jhumki. Jhumki has been a good friend. So thank you, Jhumki, for making time and joining us. I think Jhumki really understands business world much better than some of us who have been talking about business and public health. So maybe to start with, Jhumki, I think I'm aware that recently you led a study where kind of you looked at the business disclosures, particularly. So in the world of business and human rights, or in business responsibility and sustainability, I think the fact that businesses are expected to make disclosures not just financial disclosures, but disclosures around the matter of how businesses are affecting society, affecting environment, in some sense public health as part of the social kind of indicator, is becoming really a cornerstone of how business responsibility is being seen. In fact, to some degree, now there are regulations which mandates businesses to do this globally and also in India now. And I think what Jhumki has done more recently that I am more excited about is that she looked at how how to see these business disclosures in respect of demerit goods, right? What kind of so I think if you can share some of the insights from that study, Jhumki, what are the kind of global best practices when it comes to producers of demerit goods? How do we really understand responsibility in that sector? So over to you.
Thank you so much, Upen, and thank you for the introduction. I'm not sure I've done so much what you've talked about, but thank you so much for that. And also thank you to Dr. Sarit and to Anna to actually set this context on demerit goods. I think it's an important conversation and a conversation that moves beyond the economics of it, right? Because so far
Jhumki, sorry to interrupt. Your voice is little feeble. I think now it may
Hello,
work.
is that better?
Perfect.
Okay. Yeah. Sorry. Thank you so much. So I think just taking forward the conversation, I think Dr. Sarit and as well as Anna has talked about demerit goods and the ramifications of that. And it is important to note, I feel that so far we have not studied demerit goods beyond the taxation, right? We've not looked at the industry per se. So if I look at demerit goods and what we have kind of looked at demerit goods is we've looked at demerit goods from the point of view of addiction. Now, when we look at addiction, normally addiction is seen in a moral concept, right? A moral judgment, like what is good, what is not good, what is good for oneself, or what is bad for the society. I think that is where the conversation around demerit goods tend to linger around, which is why some products are seen as addictive, whereas some practices are not seen as addictive. For example, going to a gym, right? That is also addictive in nature, but it is not seen as demerit. Whereas tobacco and alcohol is seen as demerit because it's comes with a moral judgment. And when we bring the morality into picture, I feel we give a lot of, and when we create that moral implication on the society, I think what tends to happen is that we tend to give a lot of power to the state. And the state tends to regulate these practices through economics, which is through taxation. But at the end of the day, I think the taxation only harms people in terms of, like, for example, it harms especially the vulnerable people. It leads to smuggling. It leads to of products such as that. So, which is why I feel what is very important when it comes to demerit goods is to look at the political economy of this, right? How does the market interact? Who are the companies who are producing it? Because only when we see these interactions between the company and the market will be able to look at the wider picture. And from that perspective, I think what we looked at and what we have done is we've tried to see how does the ESG look at when it comes to demerit goods. And I think you rightly pointed out that while tobacco is seen as seen with a lot of doubt and a complete exclusion, alcohol is still not looked at in the exclusionary list. Only very few investment and credit rating agencies are actually looking at alcohol from that lens. But what we're talking about is that I think more than that, what we need to look at is how these companies are being able to place these products in the market, right? Even when we say that tobacco is harmful to health, that it is one of the leading causes of cancer, or for example, alcohol is leading to violence or is leading to death. How are these companies being able to place the product into the market? How are they being able to brand them? I think these are the conversations that we need to really have and engage with when it comes to ESG. Now, if I look at ESG at this point of time, I think one of the limitations of ESG is that it looks at how the product is getting manufactured. What is the process that it follows from the farm to your table. But what it does not look is what is happening after it goes onto the table, right? What is happening to the consumer end of it. I think that is where we need to really focus the attention of the ESG on, and get more disclosures around what is really happening, what are the implications of the products. Have the companies done any texting on the implications of what the products that they are tabling has? I think those are the conversations, or those are the disclosures that we need to kind of look at. Another aspect of this is that, many a times, when we look at ESG also, and we look at the health aspect, while one aspect that currently is being included in ESG is occupational health and safety, right? But when occupational health and safety is also is in ESG, it only looks at very limited issues. For example, back pain, which you get while working on a laptop, or for example, fatality. It does not look at issues that come with producing a product. For example, the harms that are associated with tobacco, or rolling of BDs, or rolling of cigarettes, the diseases that come, those then get accounted for. I think that is where we need to kind of increase more disclosure, and which is why what we're talking about is a sector specific disclosure. Because what is happening in ESG is that with the generic nature of disclosure that currently exists, companies are being able to only talk about their good practices, while being able to hide what is actually harming the society, or what is actually harming the individual. So, which is why we're talking about more sector specific nuances. We're talking about the fact that the companies need to talk about which is the product that has the maximum revenue coming in from, and disclose more about those, and which is going to address some of the very critical issues that we face in India, primarily because in India we don't have company which produces only tobacco. They are into a lot of other products as well. So I think that is where disclosures need to really pinpoint towards and go towards. So only when we look at these aspects will be able to address a salient nature of these industries and the health harm that these industries comes with. So yeah.
Well, thank you. I think whenever I listen to you, I feel indeed there is more and more room for public health and business sustainability folks to come together and understand these two worlds. Because I think in public health, like Anna was saying, we have often seen some of these demerit good producer industries as vectors. Just like how malaria is caused by mosquitoes, we feel that if these industries simply should not exist because they are there, we have epidemic of cancers and many of the non-communicable diseases. And that's because we are concerned about the consumption of those demerit goods which are produced. But when it comes to business sustainability and business responsibility world, like you point out, that there is a whole blind spot on consumption. And so what we are seeing is that the demerit goods producers are flaunting very high ESG scores because they are essentially producing an irresponsible product very responsibly, right? So that's the paradox I think we are getting into. So so I think I feel there is more and more room for public health workers to engage in these debates and try to shape these debates because you mentioned something about taxation. Now I'm sure we will have different views on whether taxation works or does not work. In fact, people like Sarit have really empirically studied it. And Anna has studied how industry creates narratives about what works and what doesn't work, right? It creates a narrative of dystopic world if regulations are used strongly. So I think we really need to bridge this world, and you highlight some of the salient gaps, I think, that we need to fill in when it comes to business disclosures. What is it? I think I also like your point about sector specificity because I was just looking at, let's say, ESG report or BRSR report, a business responsibility and sustainability report of one of the largest cigarette manufacturer in India. And except on the first page where they are supposed to disclose which are the products they are producing, where they mention cigarette, the rest of the entire report, which is around 50-page report, has no mention of cigarette or tobacco because because it's a conglomerate. It is now only talking about the food and the other things that they are producing and they're working in, right? So I think this is interesting, and I think if we don't speak together across these two worlds, I think we will not do good for any. So I think, like Anna is saying, we need to do a lot of boundary spanning. Great, I'll come back to you because I have some other questions related to business sustainability. In fact, I still wonder, can there be anything called responsible for, let's say, industry like tobacco industry? So isn't there a question of product legitimacy itself Can there be something? And so I leave it up to you because I really want to hear your answer. But maybe I'll come to you after a brief round to others. So let me go back to Sarit. Sarit, you helped us write in grounding what are demerit goods, and I think one of the thing that comes to my mind is let's say some sort of a paradox which is playing out. So let's take case of tobacco and alcohol for India. What we see is that yes, they are seen as demerit goods. They are seen as socially harmful, and so we have seen governments raising taxes on this. More recently, we have seen this happening, particularly using the health logic, right? But on the other hand, what we see is that there is no significant action or reform to actually reduce or phase out production of these goods. Yeah. So what I see is that there seems to be a notion that we should just use this as some sort of milking cows, where you keep extracting revenues, but at the same time, you have to nurture that industry because that is the industry which keeps giving you those revenues. And I think this is something, in nutshell, I see happening in India. If you look at tobacco and alcohol, right? So how to really deal with this, because this leads to a scenario where we are not really reducing consumption of these demerit goods. A scenario where there is a policy incoherence. You see different government agencies dealing very differently related to these commodities, and you see weak enforcement. You see kind of regulatory capture. I think those are the features we are seeing. So how to really, how to deal with this as public health folks?
Thanks. It's a very complicated and long question to answer. So a couple of issues which you've raised. One of the things which you mentioned is that we have not reduced consumption. I think to some extent our GATS data shows we have reduced consumption of tobacco. It's not that we have not reduced. And alcohol, because in India, the question of the research and the evidence which are available in so far as tobacco is concerned, evidence related to alcohol is not that adequate. Second, there is also the evidence are very inconclusive evidence, because some of us believe that moderate drinking is helpful, and that is also now negated by research. But that research has not been so emphatic as tobacco research. So tobacco research, tobacco evidence, nationally and internationally, has been more effective for the policymakers to make a ground for their reduction in production, reduction in consumption. So far as alcohol, it is our work has not been that great. And third is your basically ultra processed foods and others. Nothing I can tell. It's very insignificant work has been done on that. A lot has to be basically done on that, impact on the children, the youth, adults, and everybody. And also, you have to understand another important thing is that India has a basically potential consumers market. There is a aspirational class in rural area who feel like they consume these ultra processed foods and everything that is helpful for their. So this aspirational class is a huge market for that. So that's another issue which need to deal with. And maybe I don't see another 10 years will require to create sufficient research and evidence to say that these ultra processing foods are really bad, and that creates urgency, obesity, and so many other health hazards. That's take a lot of time. And the history of journey of tobacco, it took a lot of time, at least to convince to the policymakers. No, it is. And now we have reached to the stage. Alcohol we have not reached. A little bit is coming up. And the USP completely, we have not zero. It is an ASEAN stage. So we have to start that. So this is my take on these three issues. Then coming to the question specifically, what works, what does not work, and what are the issues here. I'll take some of the examples of basically tobacco products and others. Because most of the work on tobacco taxation has been for a long time. And you might be knowing, for the other people who are in the audience and others, in 2017, there is a huge reform in the indirect tax regime which happened because of the introduction of goods and service tax. And we actually transitioned from, we had earlier different types of taxes, and we subsumed all the taxes, and we want to simplify the tax structure by introducing a tax called goods and service tax. So 2017 we have imposed this. We have been imposing this goods and service tax. Earlier, if you look into the tax structure, we have a excise duty, we have the VAT, we have a compensation set, we have a national calamity contingency duty. So many things were there. But when 2017 we subsumed everything now. But in tobacco, what happened? We have a GST. Apart from the GST, we have also a compensatory cess which was imposed on the tobacco products. That cess basically, that compensatory cess is basically imposed to provide revenue to the states which lose their revenue because they transition from the other type of taxes to GST. And GST is a consumption destination-based consumption tax. It is not a producer state. For example, if Gujarat is a producer state and Odisha is a consuming state, so GST will be imposed at Odisha where it is consumed. So Gujarat will lose its revenue. Therefore, to compensate Gujarat, Government of India imposed a compensatory cess that is which imposed on tobacco products. So we have in the GST after introduction of GST, we have this compensatory cess. If you look into another issue, the complexity in that we have in the tax structure, there is a specificity and an arboretum component in the excise component. So specific tax is that tax which is imposed on the size of the product or what it contains. For example, cigarette, there is a 65 mm length, there is a 70 mm length, and the tax are different for 65 mm and the tax is different for 75 mm. That is called as a basically specific tax, basically based on the length of the cigarette or if it is filtered and unfiltered, then tax are different. So specific tax. And ad valorem tax is a tax which is imposed based upon the prices or the value of the product which we declare. So historically and literature suggests that specific tax is more effective in basically deciding in regulating the consumption comparison to ad valorem tax. Specific tax, what happens is the producers cannot manipulate the tax when it is imposed on that. But in a case of for explaining you the audience, in a ad valorem tax, when you are to declare the value, you can declare the value of the lower volume products or lower priced products. You can declare less value, so you can absorb some of the taxes. The industry can absorb. But in the case of specific taxes, there is a more likely that industry cannot absorb. They have to transfer the tax to the people. That happens. So actually, there is a lot of problems happened. That GST objective was we have to simplify the tax, and the tax we have to impose the tax in such a manner that products should not be affordable. Affordable in the sense that your purchasing power and the prices, your prices should increase more than your income, so that it becomes less affordable. But on the contrary, what we find evidence suggests in 2017 others, tobacco products basically has become more affordable even after the imposition of GST. So GST has not worked to basically basically dissuade the consumers in terms of the taxes. Therefore, a lot of questions arises about the effectiveness of the taxes on the tobacco products, because if you look into some of the measures like what is the share of tax as a percentage of retail price. So WHO tells me that share of tax should be 75%. But still India, if you look into cigarette and others, so it is 55 to 57%. And another product which is a bidi, which is basically consumed by many people, and in that case the tax as a price is only 22%. So there is a huge discrepancy there. That in order to be that product to be effective, tax rate to be effective, then we find that our tax rate has not been effective if you look into all these international measures. So because there are two things, we have not, after GST imposition, there are very few years where the tax rate has gone up. Tax rate government didn't increase. Then this another business which has come up, that the compensation says the date was this March 26. That has to be basically government has to withdraw. Now then government has come out with an additional excise duty. They have declared from the February 1 that additional excise duty which will be imposed on these tobacco products. So there is another issue with that the complex why the taxation has not been effective. It's because your tax rate has not gone up. That is number one. Then there is a multiple taxes. You have not simplified the taxes, which was the GST objective. That we have not done. Third, price and taxation they don't go hand in hand. So, and the fourth most important thing is that what I feel, which is very critical for the tobacco taxation point of view, that one of the issues which has basically really affected the industry is that industry is allowed to produce a lot of products. Why you have in a cigarette, you have like 6 tiers of cigarette, 6 lengths of cigarette which is available in the market. If we are accepting it is a demerit good, it is harmful for the people. Why you allow a industry to produce 6 types of cigarettes? You have a high price, low price, medium price. Then he can play in between the prices when the tax is imposed on that. You just tell no. You have a restriction. 2 tiers of cigarette will be available in the market. No 6 tiers, because it is a demerit good. It's a harmful good. Why you give a choice to the consumers? You should not industry should not give a choice to the consumer. It's not like my shirt or my watch, what I consume for my luxurious product. Choices are available. You should restrict the choice. That we have not done. So therefore, taxation has not has not been effective in reducing consumption. There is a lots of room to do. And so far as alcohol, I will finish with alcohol. Alcohol, what has happened? Alcohol has left basically. If you look into the GST, since alcohol is a state, it's a major tax item for the tax revenue item for the state governments. State governments have basically argued with the GST Council to keep alcohol separately. So all the states are imposing the state excise, it's called excise duty on the alcohol products. Alcohol is not part of the GST, because if it comes to the GST regime, many people, the tax will lose its revenue. So alcohol cut, there are a lot of issues in the alcohol taxation, so that we need separately to discuss. But if you want to the revenue argument vis-a-vis the economic cost argument, the economic cost, basically health cost is much higher than the revenue. If one recent study which we did, and recently that has been updated, it states that we just the economic burden of tobacco attributable diseases is like it's like 1.0%, 0.4% of the India's GDP. If the total economic burden of tobacco attributable diseases is 1.0%, 0.4% of GDP. That's a huge amount. If you look into the revenue vis-a-vis the expenditure, the revenue is only 12% of the expenditure. That's a huge number that to tell to the government. So if I am spending 100 rupees on the health cost, I am just generating 12 rupees through a taxation. So therefore, when you make a policy argument with the government, then your health cost argument wins in vis-a-vis the revenue argument. Revenue is not much more. Right. Revenue is not a very attractive thing if you compare revenue with healthcare cost. So always it is better to compare the economic burden because of the disease, the death of the people, premature death, everything taken together, and you value it in terms of the cost. Then you compare it to the revenue what you are generating. Then the evidence is available which tells that your revenue is just 12% of the cost. So that's why for your government is not a very attractive source of revenue to the government. There are many other attractive source of revenue to the government, because why you earn a lot of revenue, then spend money by increasing your health expenditure. You don't need to do that. So these are two contrasting things. You first make people sick, then you spend on them to make them cure. So why are you doing that?
Yeah. Thanks. But I think somehow that contrast remains and kind of maybe because I think a lot of that cost is borne by us individuals, out-of-pocket expenditures, given the larger makeup of our health finance in India, unfortunately. But as we go towards universal health coverage, which government seems to be committed to, we'll have to start worrying more and more about those costs which are being picked up by individuals today. Great. So I think while there is no easy way out of this conundrum, what I get is from your arguments is that one, we need to generate more evidence, and I think more recent evidence in alcohol makes it clear that there is really no safe limit of alcohol consumption, just like tobacco. But I think it is going to take time to sort of do that communication more effectively, and so is with other substances which creates public health harms. You also point out that while taxation is an effective policy, but our tax system, despite large reforms like goods and service tax, which are aimed at simplifying it, tobacco taxation has remained still very complicated and complex, because we have too many kinds of taxes, we have too many different kinds of products, and different ways in which we levy tax. And I think that's where you advocate for more simple system and more specific taxes which are more effective, and we are still lagging behind in terms of increasing the effective tax rate on cigarettes, so they are still remaining more affordable, so there is room to do more. Great. So coming to Anna, Anna, maybe I'll bring a bit more questions related to how the knowledge is produced around commercial determinants of health, because I think you have really been working in that space globally. I think while I personally find the developments in CDOH scholarship very useful, and we have been kind of trying to use different frameworks that have been developed over time. I also see some of the areas where, let me just give some examples. Let's see, even tobacco control, for example, the area where I worked for a long time now. The reality we see around, let's say, not far away from where I'm sitting, there are huge tobacco growing farms in my state. So we are one of the largest tobacco producer, and the people who are producing tobacco are not corporations; they are smallholder farmers. Then we are also a large market, like Sarit is saying, for demerit goods. In tobacco, there is no big multinational corporations. It's India's own companies which have grown big and has kind of established kind of a nexus with government. So what I try to say is that while
ITC is linked with BAT. ITC is also part of BAT. There are transnational. Yeah.
True. No, it was in fact Imperial Tobacco Company and got nationalized much later in 1970s. But what I meant to say is that when we engage with FCTC, let's say, for example, the kind of challenges we faced over time is that we couldn't see much room for smokeless tobacco in FCTC, at least to begin with. A lot of global discourse has been around cigarette, around smoking tobacco. And I think in India, the chewing tobacco, and there are many, I think we may give a label called smokeless tobacco. I think that label also evolved as a contrast to smoking tobacco. But in India, to use smokeless tobacco is a bit misnomer, because there are nearly more than 100 ways in which people consume tobacco, which is not cigarette smoking. And so I think it's not a very good analytical level for a researcher to work with in this country. But what I meant to say is that when we engage with FCTC, when we engage with global debates, somehow we feel that they still not provide very meaningful lens to look at the problems we are facing. Let me give you a few other examples beyond tobacco. Let's say in CDOH, again, what I see is that there is a lot more empirical work around, let's say, demerit goods, particularly. There is a lot of empirical work around multinational corporations. But in India, we have much of the private sector is a smallholder private sector. I mean, in most of the sectors, let's say the MSME sector, what Jhumki is often engaging with, they are not like very powerful large entities, but they are made up of many, many smallholder entities, right? So what I meant to say is that it looks like that to develop a more effective way of understanding and dealing with CDOH, particularly not missing out a large part of the globe, we need a lot more collaborations. We need a lot more voices from, let's say, so-called global south, to be provocative, though I don't like those terms. But we haven't seen that much. I think the voices from global south remains relatively marginal, at least in the way where CDOH knowledge gets more legitimized. So I'm wondering how do you see this issue, and would like to hear from you if you have some suggestions on how to really break out of this.
Well, I think you're touching on so many different issues there, actually. Let me try and piece some of them together. So some is what is the nature of business and how does that vary? And you're right, there's so much of the research when we look at it is about big multinational and transnational corporations. The reality is globally, 90% of economic activity, I think it is through small and medium enterprises. So all of us have got to get way more sophisticated in how we understand business and the nature of different businesses and so on. And actually we used a sort of neutral definition in our definition of commercial determinants of health in the Lancet model very deliberately, because okay, we're interested in the negative impacts, but of course businesses have positive impacts on health. They give us jobs, they create products that we need and so on. But we need to sort of reshape that so more and more positives come out. And to do that, we've got to also understand the commercial sector far better. We've got to work with the commercial sector far better. We've got to think about how do you harness ESG. We could come back to that. So I think there is a huge research agenda, and the world, you know, we have a global economy. Okay, that's getting more complex now, but we also then need to look at this globally. And, you know, one of my, you know, and globally, there's a number of patterns that I think are particularly troublesome. So, for example, increasingly the harm of these demerit goods is shifting to the global south, but the profits are increasingly shifting to the global north, and within that to fewer and fewer institutional investors. And this is part of the sort of widening of inequalities. Actually, I looked up the data for India in the World Inequalities Report yesterday, and you've got exactly the same issue, this concentration of wealth within the private sector while public sector wealth stagnates. So you need your taxes. You know, we have the same issue. And then we've got like trade and investment agreements, which are both opening markets, but actually one of my other interests is not just how they influence downstream policy, but how they influence what I call upstream policy, which is the rules on how policies are made. And I've got a PhD student currently looking at this. So we know they've set up rules on rules on how policies are made, for example, across the European Union, in the UK, that favour corporate interests. And it's almost certain that they're pushing those rules into chapters of trade and investment agreements and globalising these rules. So we've got to sort of wake up and work together. So how do we set up the structures that enable that? It's, you know, through these sorts of conversations, through meeting together, through and I don't know, I hope that one positive development in this area is the World Health Organization now has a unit working on the commercial determinants of health under a broader banner of social and economic determinants of health. And as part of that, they did do regional reports to look at, you know, what were the issues in different regions in terms of commercial determinants of health. So that and a global report will come out this year from that unit. I'm hoping that will provide us some sort of infrastructure and momentum to try and move forward at these debates. But, you know, the complexity is, you know, where are the funding streams to bring us together? How do we do? So either we just do this at a personal level, you know, you and I meet up, you know, maybe we expand those networks gradually, or we try to very deliberately look at funding mechanisms. And I mean, the interesting thing about the Framework Convention on Tobacco Control that you mentioned is, in many ways, that has been a success story. And we have a global tobacco control NGO that convenes in that space and brings people together. And in many ways, that is a success story. But within that success story, you're saying that, you know, the huge problems of smokeless tobacco and the many forms of tobacco use are not seen. And the interesting thing is perhaps had they been, I think they will be seen more now because the tobacco industry has diversified. And so this issue that, you know, we shouldn't just be focusing on cigarettes. We need to every piece of legislation, in my opinion, needs to apply to all tobacco and nicotine products. So you've got everything covered and you don't specify, because then you're future-proofing. And so arguably, if everyone had listened to the problems you're facing from the get-go, perhaps it could have been set up like that in the first place, which is an example of why listening is so important. I mean, I wonder whether if we look at other sectors, you guys might know, are there other areas, human rights, or where actually the global networking works better than it does in public health? So is there a model we can use? I don't know. I think that's more of a question for you. Where do you see these international dialogues and these global dialogues working more effectively? Or do you? Is there a model we can use?
Yeah, no, I think Thanks for your comments. I don't, like you said, I also don't have answers. I don't have ready answers, but I think I'm glad that we are opening up these conversations. And like you said, maybe we need to learn from how other folks have figured this out. Are there other such networks where, because I think I also believe in what you said, which is that listening to each other is going to be helpful for both. It's not that one is producer, one is consumer, but I think if we have this dialogue happening across, maybe we all will be able to, address CDOH more effectively.
Yeah.
There have been
I have
actually,
one-
sorry, yeah, go ahead.
Can I just flag one thing? So one thing I've thought about is, so, and your work is on this really, Pendra, that, we had colonialization and the extraction of wealth, and now we've got, commercial extraction of wealth really following in these colonial lines. So one thought I've had is that, low and middle income countries could make a case within a global forum for reparations. And if they made that case, would that then open the sort of the dialogue more and put pressure actually to develop international funding streams that would help us, work together and look at solutions? It's like
interesting. No, I think we must, because I think we have seen that
find a way into opening this up, scare the government so that, if you won't get the reparations, I don't think, but it might then say, okay, here's some funding to work collectively or something. I don't know. It's just a.
No, I think good to explore, because I think I have heard such debates happening, at least in the area of climate justice and environment justice. We haven't heard this in health sector per se, right? While decoloniality is being now debated in health so much. And I think it would be interesting to see how that can be pursued. In fact, whatever little push was there in international funding system to make it more collaborative is slowly seems to be again being reversed with rising defense expenditures, and grant calls are becoming much more nationalistic and stuff like that. So yeah, maybe coming to Jhumki and then maybe opening up for another 15 minutes for any questions, comments we have. We already have a couple of questions. I encourage you to look at the chat box. Jhumki, coming back to you, I think let me build further on that idea of epistemic kind of whose knowledge counts, but more in context of business disclosures, because when I read a lot of such business reports, business responsibility reports, what you also sense is that this is a very highly policed language. Yeah. In fact, you have alcohol company from India talking constantly about how they promote positive drinking, moderate drinking, etc. And so what looks like to me is that not only consumers who are, like you highlighted, that consumers seems to be bit marginal stakeholder in business responsibility and sustainability debate, because a lot of it is focused about production and disposal, not so much about what consumption is doing to society. But workers, I think, and I think we have touched upon a bit about the marginality of work in global south. Global south, I mean, India is a big supply chain for major global corporations. And I highlighted how a lot of global profit moves there while work happens here. So the work itself and workers themselves seems to be another marginal voice when it comes to such reporting mechanisms. And I know that you have been kind of concerned with that. So would like to hear a little more from you in terms of how can we make these business disclosures not coming out of those four big consultancies supporting corporations, which will always happen, but how can voices of other stakeholders who are particularly marginalized, workers themselves, the society, the communities living beside large manufacturing plants, or who are directly being affected, or consumers, how their voices can be more actively incorporated in such disclosures. For now, they remain very passive, if at all. So yeah, if you can hear more from you about that.
Sure. Thank you so much, Upen. I think you rightly said, I think today the
Jhumki, you can
reports.
move that.
Sorry. I think you rightly said today's ESG reports or sustainability reports are actually the stories of the company, right? Like how the companies are producing, what they are doing, what is great that is happening. For example, what they are doing the best in CSR or environment. I think that is what the ESG has come to at this point of time. However, what it misses is the workers' narrative, like you rightly pointed out. It misses the consumer narrative. So which is why what we are talking about and we have been kind of struggling to do is basically kind of decolonize these ESG frameworks, talk about more ground up knowledge as opposed to top down approach to these ESG frameworks that is currently happening, where the company tends to control the data. And these data are then provided to these big fours, who then furnish reports that paint the company in a very good light. However, what we are trying to say is that that is not what the company is. It is the impact on the people, the impact on communities, the impact on consumers, the workers that need to really be reflected in ESG, and that cannot happen unless and until there is more grounded knowledge that is coming in. So, what we are talking about is for example, in terms of workers, we are talking about worker led due diligence architecture, where workers can talk about what is actually happening. What are the occupational health and safety hazards that they are actually facing today, which looks beyond the back pains and the leg pains, which is looking beyond fatality, which is looking at other issues that the workers are facing at this point of time. For example, in the textile sector, a lot of workers are losing their eyesight, but that never gets accounted for when we talk about occupational health and safety. Or for example, the way in which we saw, in Maharashtra, in the in the in sugarcane farms, how women were operated upon and their uteruses were removed, and that is an occupation that's a hazard that the companies are not really talking about, which is why we are talking about a worker led due diligence architecture. Within that worker-led due diligence architecture, I think what we also need to look at is what the consumers are kind of also talking about. What was happening, unfortunately, it did not happen, is that uh, in the first version of the report that had come out in the BRSR uh, and the BRSR core currently, there was a question around whether the company has come under has basically is there a controversy surrounding, or is there a news article which presents the company in negative light, which is there. However, that question got omitted from that core, which could have brought at least some bit of understanding on what is happening at those people in terms of workers, in terms of consumers. So going back, I think what is needed is more ground up knowledge, more experiences. This is what we at Partners in Change are trying to do. Get these voices out. Make sure that these voices are kind of, moving the conversation around ESG, moving the conversation around sector specific guidelines that would then translate into making the companies, start reporting on what they are doing in their sector. Because right now, the companies, like I also said, are talking very generically in their ESG reports, which is why most of the companies, like you also pointed out, which are actually in the negative light, are actually getting better scores. Like, for example, if we look at tobacco companies specifically, the PMIs or the Altria or Diageo, the alcohol company, I think they have the best ESG scores at this point of time. In fact, at one point of time, I should not use that as an example also, but their ESG scores were better than Tesla. When Tesla was painted as one of the green companies. So this is primarily happening because the voices are not present. And that's why we're talking about deconstructing this due diligence architecture. How can the problems be identified not by the company, but by the stakeholders who get impacted by the products by the company, or by the workers who are involved in the value chain of the product? And how then those issues are taken up by the company and resolved? I think that's where I think the meat of the matter lies, in talking about how it is impacting the workers or the community, and the workers themselves actually talking about it. So yeah.
Great, thank you. I think more strength for worker-led human rights due diligence. I think it's interesting when I hear all three of you, whether it is about revenue paradox in demerit goods, or whether it is about hegemony of knowledge or voices of certain stakeholders in corporate or commercial determinants of health. What is clear is that we can't escape the political economic question, and we must bring that as a lens to look at things, right? Instead of getting lost only into one or other strategy of taxation or something else. I think without a question of power and political economy, it's very difficult to confront inquiries within commercial determinants of health space. So I think with that, I see that there are a couple of questions here on the chat box. And I think when I hear about comments and later on question by Mr. Vasant Kumar Maisurmat, whom I know as one of the leading tobacco control voice in Karnataka, in my state, I can see the long-term kind of engagement and frustration in terms of why this paradox within tobacco control remains. Why is it that we aren't able to take decisive steps on reducing tobacco supply and look at tobacco industry very differently? I was posing similar question to you earlier. I don't know whether you want to have any further remark, Jhumki, on that, which is that how to even understand responsibility or business responsibility in context of companies which, let's say, provide goods which are really lethal and there is hardly anything to be gained out of that kind of production. I know it's
Sorry. Yeah. No, I think while we might hope that these companies will move out, but I think looking at the market and the way in which it happens, we cannot foresee a very soon in the future that they will actually move out. I think what is really needed is that they need to start reporting on it. They need to
right.
talk about, what they are producing. Like you rightly said, one of the biggest tobacco companies today in India does not talk about tobacco in the ESG report. I think that's where disclosures need to really
Right.
come in, right?
So I think,
Prominently
yeah.
stating that, I think that's where responsibility really
So at least
lies.
start
Yeah.
bringing that narrative out.
Yes.
Yeah, in fact, one of my colleague, Abhinav Tyagi, who works with me on CDOH issues, he also often points out, he comes from history of science and technology background, and he says, when he reads about tobacco endgame, because we are talking about tobacco endgame, we are talking about endgame of tobacco industry per se, while our core concern is really about ending the tobacco use or tobacco consumption. And he often tries to think that, can we think about other ways of creating new kinds of economic entanglements where whole paraphernalia around tobacco industry, be it workers, natural resource which is being mined, the kind of systems that have been created over years can possibly sustain in different forms. Just like how, for example, at some point the liquor, to be a form of human consumption, was also exploited commercially for various chemical use and industrial sort of chemical use. I don't think it's completely new, but I find it interesting because I think much of the public health debates around tobacco endgame has not focused so much on actually exploring. And then when I work with him, I see that indeed there are ways in which different kinds of commercial exploitation might be possible, which is not about leisurely human use. But anyway, I think this is not really a binary question. I think it will take years and it will take certainly innovative thinking because clearly the traditional strategies are kind of not working out. I see Malu Mohan's question in the chat box, and I don't know whether some of you want to respond to it. I'll just try to read it out. Malu says that much of the demerit goods framework focuses on the effects of consumption and externalities. However, merit goods such as healthcare or health professional education can themselves generate significant negative externalities when produced in a highly commercialized ways. I think she refers to the growing commercialization of medical education in our country.
Healthcare.
Yeah, and in healthcare in general. Should we then focus on how goods and services are produced, financed, and organized, and on the transparency of these activities rather than only on what their consumption leads to? I think very interesting. I mean, though we were on demerit goods, somewhere this kept coming, I think, how
For me,
do, yeah, over to you, Anna.
this is a really, really important bit of the commercial determinants of health because there are merit goods. There are goods that we need and we need to protect. And if those goods are privatized, so it might be healthcare or it might be water or, that we end up in real problems. So we need to also understand, and this is part of this bigger, trying to understand commercial determinants of health more broadly. What is the behavior and the drivers of these corporations? And as soon as you have big corporations and financial investors investing in healthcare and so on, and asset stripping, or just taking out more and more profits, often then going up to the global north, whatever, we have problems. And in that space, as in the sort of demerit goods, we need government regulation. So we need government regulation to protect the public interest and to sort of address. I mean, you could call them market failures, but we need to understand these different elements and different routes to commercial harm. And in all of those areas, we need government regulation. And just to go to the other questions about tobacco, I mean, sometimes I think that if governments are failing to act in all of these areas, maybe we have to think about strategic litigation. Government has a duty to act in the public interest. It has a duty to protect our health. It has a duty to protect human rights. If it's not doing that, should we think about strategic litigation to kind of get this on the agenda and put pressure on them to act? I think we have to start, we're playing the game down here. Sometimes we have to look up and say, what are the other opportunities that are open to us? And Jhumki, I just wanted to come back because I really like your ideas on, can we make ESG work? Because it doesn't work now for public health. And it seems to me a total farce that, there's all this evidence that we have on, what are the real impacts of these corporations. They never use that evidence. As you say, they just use the corporation's evidence. So, we need to turn this on its head and maybe have a hierarchy. Like, is the primary product of this corporation harmful? Yeah, so therefore they should not be in an ethical fund. They're then demoted. And then you could look at the sort of, the labor practices and the supply chain practices and the stuff, but that's sort of on the margins of their impacts. And my experience is that when you talk to businesses that are doing good, they see ESG as just a total farce. They're like saying, look, I could, one person said to me, look, I could be producing, tobacco, a product that kills everybody, but I can have solar panels on my roof and I will be in the ethical investment fund. It's just a farce. So for them, it's just a chore. But for the corporations that are most harmful, they engage in this non-stop because by having the solar panels, they reach the top of the index and it's a farce. So we've got to change it.
Yes, I think very interesting take. There is also a comment or rather a question by Pooja. She says, what policy tools have been most effective in addressing commercial determinants of health? I know it's a bit of an umbrella question, but if anyone of you wants to make brief remarks, particularly prioritizing the things that you feel are either more effective today or where we need to invest more, I think.
Just I want to come just two issues. The
Yes,
other
sir.
question also. One of the questions is that the demand side measures are not working. Why you can do straightaway supply side basically you stop that in a democratic country. You have to understand the political economy. That doesn't work straightaway. Otherwise, you could have stopped the production. So you bring a regulation, you tell the companies you stop. But why the government is not doing for 78 years? So anywhere in the world, it does not happen in like that. You have to understand the entire context of establishing that industry and the choices of the people and democratic values. So many interlinked questions are there. Therefore, we cannot go straight away that yes, why you cannot stop a company and to stop production. It is a one-day affair. Then you don't need the 50, 70 years of struggle. Why this is not happening? It is not happening because the political economy is very complex and in a democratic such a country and the industries are there. You cannot do such type of things in a straight way. And anywhere in the world, it has not happened like straight away can stop production. So that is a question where it is a struggle. Therefore, you have to be patiently basically work in this struggle and it is a fight between the public health experts and the industry, and it will take time and gradually there is a reduction is happening. It's not that it is not working or it's not. If you look into the totality, for example, one example of that, you can just if you tax very heavily, then you can basically initiators, those who are starting, you can stop them. Either youth, college going people, if that it is very unaffordable to them, they cannot purchase. So that is a question. So basically, You may not have to stop the habitual smokers or drinkers, anything like that, but those who are initiating the products, we can stop heavily through taxation and others. Taxation, price measures, advertisement ban, all other things. And apart from price and tax measures, there are other measures are also there. For example, why you promote a product as an agricultural product, for example? That's a question in India. As Upendra comes from the state of Karnataka, where it is heavily produced. Then you have to stop that also, that production process. You have to discourage the farmers and to find out alternative livelihood sources and tell the farmers that there are other alternative livelihood sources which are more profitable to you, and there are also health impact if you produce those things. You have to go and explain. And there are experiments in the country, but that experiments has not been very popularized. I think the livelihood experiments are there. Many alternative livelihood experiments for tobacco and others are there, definitely. But that has not become so much popular, so that farmers will be very much attracted to produce the because the type of revenue which they generate from tobacco and the type of revenue which they generate from other products are comparable. There's a huge disparity between that two. And how to reduce that disparity, and how you tell that key, no, you, if you don't produce, your future generation, you have to save. So many ways you have to tell the people. So it's a persuasive matter. It does not happen one day. It will take time. So we are doing in a policy level. We as a researchers, our duty we are doing. There are advocates, there are doctors, there are basically so many people. There are NGOs, there are corporates. So you have to join hand in together to influence that. It's a battle. It's a fight, and that fight, it will take time. And then slowly we have achieved something in tobacco. Alcohol and other demerit goods, it will take time. I'll stop.
Great. I take that as a message of hope. And maybe if you have a last brief concluding remarks, Jhumki and Anna, in that order, if you want to come in. And then I wonder that's the only time we have today.
I can say that there's a final question there. What policy tools have been most effective? I don't think we have in CDOH. I don't think we have the answers there. But what the things that I see as really key here in moving forward, and this is learning primarily from tobacco and more in the sort of health harming bit of CDOH. But I think denormalizing these industries, improving transparency and governance, and actually that will work across the board. And we need to simplify our understanding of transparency and good governance and conflicts of interest, so that the conflict is not between the product. The conflict is the corporate interest in maximizing profit. So if I'm selling pens and the government is developing a policy on pens, I should not be at the table. So we need to work towards this much more simple understanding of conflicts of interest and improve governance there. And that will really help. I know this is idealized, but I think also we have to protect science. The ways that corporations influence science has a huge impact on their power. And I think we need to start looking at polluter pays approaches. So how do we move towards a position where these corporations are paying for the harm that they cause? Because governments need revenue, increasingly so, and these corporations are not paying for their harm. And because they're not paying for their harm, their power is increasing, and then we develop this vicious cycle. So those are just a few ideas to throw out there at the end.
Yes, thank you, Anna. Jhumki, you want to come in?
Yeah, I think just going back to what Anna had also talked about, uh, uh, I think it's important to decolonize all these conversations, right? And I'm talking about colonization, not in decolonization, not in terms of like territorial, but in terms of who holds the power in these conversations, right? Like we need to talk about the capacity building that is happening in the name of responsible business. We need to tackle issues around certifications that are happening, that is allowing companies who are producing demerit goods to go on producing those. We need to talk about fund flows, how funding is actually flowing to these companies, while there are so many investors saying that I will not fund tobacco, but still tobacco is getting funded. It's getting tobacco funded from somewhere. I think we need to address these power centers. And unless and until we address these power centers, we will not be able to address the issues that are caused because of demerit goods. Because demerit goods will continue to exist. The companies will continue to produce them, and there's a huge section of consumers who will continue to consume. So in order to nip the problem in the butt, I think we need to nip the issue itself and stop the fund flows, stop the certification industries, and stop these capacity building that is happening in the name of ESG. Yeah.
Great.
yeah.
So you're highlighting a new and emerging set of industrial players, which we really don't engage with. So great. I think unfortunately that's the only time we had today. And I thoroughly enjoyed speaking to all three of you. There's a lot of very useful insights, but also some questions which we didn't answer, but I guess those are powerful questions for many of us to keep engaging with. And I hope that it gave good food for thought and sort of motivated many of our participants to keep working in this area of commercial determinants of health. We'll keep curating periodically such conversations and engaging with such scholars. For now, we'll have to end it here. So my sincere thanks to all three of you. Thanks, Anna, Sarit, Jhumki, for spending time with us.